Hello everyone. Rupa,
Hi, ma'am.
hello.
Good evening.
Good evening, ma'am.
We have only 3 students. अभी तो बहुत सारे बच्चे थे, कहाँ गए? Okay, so let's start the class today. Okay. Did you do the question that I sent yesterday?
Yes, ma'am.
Yes, ma'am.
Okay. So how much did you get? I sent you the answer also.
10 by 8. 8 by 10, ma'am.
Good evening, ma'am.
Rupaka, how much
Yes,
you
ma'am.
get? How much you got?
I got 8 too.
How much did you get?
8, ma'am.
8, ma'am.
Sorry? Out of?
Out of
10.
10. There are
Sorry?
only 10 questions.
Okay, so you got 8
Out
in
of-
in
Yes, ma'am.
pneumonia.
Yeah.
Yes, ma'am.
Did you understood the question now?
Yes,
Yes, ma'am.
Everyone? Okay,
Yes, ma'am.
so let's do. Can you see the screen?
Yes, ma'am.
Okay. Okay. So today's topic is going to be your ARDS. Does anybody know what is ARDS?
Yes, ma'am.
Acute respiratory.
Fluids collection
Not just
in
fluid.
the air sac.
Full form, acute
Respiratory.
Respiratory
distress
distress syndrome.
respiratory distress
Distress syndrome.
syndrome. Okay. So there are few terms that you have to understand. Okay. So there's acute. Acute means
Short.
very good. Short. Okay. Respiratory means
Involving lungs.
very good. Involving lungs. Okay. Distress. What do you mean by distress someone? What do you mean by distress?
Restlessness.
Okay. Problem. If I see
Problem.
something is distress, something is in the problem. And what is syndrome? Sign and symptoms. So many sign and symptoms. So this is your acute respiratory distress syndrome. Yes, so this is acute
Yes.
respiratory distress syndrome. Acute means in a very, very short period of time. Okay. Respiratory means only your respiratory system is being affected and involved. Distress means
More
Problem.
problem. Syndrome means there
More
are so many
symptoms.
other
Symptoms.
signs
So
and
many.
symptoms associated with this disease. So this is what your acute respiratory distress syndrome.
Distress.
So when I say acute, what do you mean by acute? What is the time period to define acute?
Sudden or time
No,
period.
the time period. So what is the time period that you say that this is acute?
Short term, ma'am. Like
No, what is
one-
the exact time? What is the exact time?
2 weeks. 1 week or 2
one
weeks.
week. Uh,
1 month.
acute.
I think 1 to 3 days or in a 1
1
day or
hour,
2 hours.
even one few minutes also.
No, minute you can't say. It happened in status asthmaticus. In minute the
Yeah.
conditions. So acute means 1 week. The situation started
1
within 1 week. Okay. So the situation started within 1 week. Okay. Time period is going to be 1 week. Next thing, 1 week of worsening of your respiratory symptoms. Okay. 1 means like 1 week, the sign and symptom has worsening. Okay, it means that earlier the patient has some few sign and symptom related to the respiratory, but within 1 week, the sign and symptom worsen so much that the patient is having difficulty in breathing. Okay, your second word is it is bilateral opacity. Okay, when you see the x-ray of a patient, you will see in both the lung there is problem. So there is bilateral opacity. Okay, third is your cause should be, listen to me everyone very, very clearly, the cause should be exclusively pulmonary. The cause should be exclusively pulmonary. It doesn't mean that, okay, I had my heart failure. Heart failure can also lead to your pulmonary signs and symptoms. But when I'm talking about ARDS, the cause should be completely pulmonary in nature. Okay, the cause should be okay. Let me give you one thing. Let me tell you very clearly one thing. When we learn about diseases, okay. For example, I'm talking about heart. Listen to me very everyone. Amul, Priya, Rosaline, Subel, Govindraj. Okay, you need to understand one thing. Open your cameras, okay? And then let's talk about it. So, for example, if I'm talking about heart, so we have an organization which is known as American Heart Association. We deal about all the topics related to the cardiology. Okay, so they do research every time they see like what are the other diseases are coming. So especially for lungs, there is a special organization which deal all the problem related to lungs. So there's American Association of Pediatrics. So there are so many other association involved. Okay, when I primarily talk about our lungs, so there are other signs and symptoms associated with lungs, like you're talking about pulmonary. So there has to be one organization who is talking about lungs. Okay, so it is the organization which recently have changed their guidelines. The guideline has been changed very recently. It is in 2021. I will show you the recent guidelines. Okay, which talk about ARDS. So there has been a change in the ARDS. Okay. Next, I said the cause should be pulmonary in nature. Third thing, there should be hypoxia. These are the 4 things that should be taken in consideration when I'm talking about ARDS, because ARDS is medical emergency in respiratory. Repeat with me. 1 week of worsening condition.
yes,
1 week
yes.
of
What is,
worsening
ma'am?
condition.
1 week of worsening
Bilateral
conditions.
opacity.
Bilateral opacity.
Very
Cause
good.
of pulmonary nature or
Pulmonary in
hypoxia.
nature.
Fourth thing is your
Hypoxia.
hypoxia. Okay. So
Hypoxia.
let me show you what exactly pulmonary means to you. Okay. Let me show you what pulmonary means. Okay. So I'm so sorry. The recent guideline has been changed in 2023. Okay, no 2000. So let me show you. So the recent guideline says that there are 4 criteria which you need to be linked. This is from the Journal of Club Acute Respiratory Syndrome. As you can see. Can you see this thing?
Yes, ma'am.
Yes, ma'am.
Saying the time up to 7 days. Arey, kya ho gaya?
Can we
Okay,
take a
up to 7 days. Can you see the first thing is up to 7 days? The condition has been started worsening within 7 days. There is pulmonary edema, non-explained by cardiogenic edema or intravascular volume overload. It is just due to pulmonary nature. It has not been affected by any cardiologic reason or there is any kind of renal. You should know one thing. Okay, everyone look at me. When I'm teaching you about lungs, you should know that heart, kidney, lungs, these 3 go hand in hand. If one organ get affected, both the organs will get affected. Versa versa. Okay. So these are related. Okay. Next, radiological feature, bilateral infiltration of X-ray, lung ultrasound by trained professionals mean that there is bilateral opacity in both the lungs will affect it. The 4th thing, there is hypoxemia. You don't have to learn these values. And hypoxemia. Understood the 4 criteria? The
Yes,
recent
ma'am.
guidelines of 2023 state this thing. Okay. Now let me show you the better picture of ARDS. Okay, where is my lung? Okay, you need to see everything over here. Okay. Look at this right side. Okay, look at this right side. This is, if I'm making an alveolar, okay, alveolar. If I'm
Alveoli.
making an
Alveoli.
alveoli, yes, thank you so much. So, listen, the alveolar membrane is very, very thin. Can you see this is only made up of one? In the lungs, in the alveoli, there are 2 types of cells, type 1 cell and type 2 cell. The type 2 cells produce your surfactant. Okay, I want to teach you about surfactant. Does anyone know about what is surfactant?
It protects the
Farhad,
lungs.
Govind, Suban.
protect the nerves?
Sorry?
It protects the.
No, I'm just asking about surfactant. Okay, tell me
It's a
one thing.
layer, ma'am.
Like it's like a surface active agents.
Yeah, something more. Okay, tell me one thing. Surfactant decrease the surface tension or increase the surface tension?
I think decrease.
It's in a break. You're going to study about more surfactant. And listen to me, I will tell you one thing. Okay. Do you know sometime when we're drinking water and mistakenly when we spill water on a wool, so this water particle collide with each other and make a small circles. Have you ever anyone experienced this kind of phenomena?
Yes, ma'am.
Someday
ma'am.
or the other, you must have seen, like when just imagine in a velvet cloth. So when you spill water on a velvet cloth, it is not going to, it will be like the water molecules will form and they will not form small bubble, not bubbles, like filled with water molecules. Okay, this is called surface tension. Okay, this is called surface tension. Due to surface tension, the water molecules collide with each other and they did not get absorbed. So surfactant will decrease the surface tension. So that's why our body water molecules does not form up bubbles and easily, because listen, this is a very small cavity. Okay, so these cells are being there. There's water molecules. There is a small capillaries around this thing. Oxygen is carrying, so it can make small water molecules. So these type 2 cells, they act as surfactant and they prevent us. Okay, so this is the normal cell. Can you see? There is no cilia. Cilia is all over here. Can you see? These are the columnar cells over here. And there is squamous, very small epithelial layer. And there's only some 5, and this is very minute. So there is an anatomical change also. So there's one thing, there's macrophages are there, type 2 cell, and their alveolar spaces. Okay, let me tell you one very important thing. That is when there is any kind of injury to your alveoli, any kind of injury to your alveoli due to pulmonary nature, just for example, a patient got pneumonia, severe pneumonia. Okay, so what will happen? The bacteria got accumulated in this thing, in your alveoli. And when there is an bacteria, just imagine there is bacteria. Okay, there is an bacteria. Okay, when the bacteria will get affected by the, just imagine this is an bacteria. Okay, so when our immune system get along with the bacteria, so when our immune system recognize that this is a bacteria in my alveoli, they start doing inflammatory reaction. I understand one thing, in the later on my chapters, I will tell you more about inflammation. So you need to be very careful that what exactly happened during inflammation. So whenever there is a bacteria, just imagine this is a bacteria. So what will happen? Just imagine this is a bacteria. So bacteria will produce antigen. Okay, bacteria is an antigen for our body. So what happened? Our
Antibodies
neutrophils,
will produce.
macrophages, and this RBC, they will start coming to the location and they will try to eat this bacteria. Macrophage will try to engulf this thing. Okay, so this is eosinophil. So what will happen? Eosinophils further will release this interleukins. Can you see this? Leukotrienes, oxidase, protease. These are going to break down. Protease will decrease the protein, oxidase, protease, fibrin, interleukin, tissue necrossing factor, okay, neutrophils, interleukin 8, RBC. Okay, so these are, can you see, inactivated surfactant, and there are surfactant like water molecules over there, protein rich edema fluid, and they will
Yes,
start
ma'am.
eating the bacteria over there, and they will protease, lipase, they will erode this because this is a very thin membrane. Okay, so they will affect the alveoli, and can you see this alveoli, and they will start hyaline membrane formation, and this wall get deteriorated. When this wall will deteriorated, there no further exchange of gases. Hence, the fluid will accommodate in your alveoli, and you will get infection as well as ARDS. So the sign and symptoms will get worse, like shortness of breath, everything will get worse, and there's a fluid in your alveoli. Understood? Should I tell you again what is actually happening? In ARDS, there are 4 things that you remember. Very quick, very acute, respiratory system acute, pulmonary occasion, okay? And there is inflammation in your alveoli. And in inflammation, there is always release of leukotriene, oxidase, protease, tissue necrossing factors, interleukins, okay, RBCs, your WBCs, your neutrophils, interleukins, neutrophils, and there's no exchange of gases. A patient will go in hypoxemia. So these are the sign and symptom associated with it. Understood, everyone? Okay. Can you tell me the sign and symptoms more?
Shortness of breath,
Very good. Shortness of breath will be there.
Dyspnea,
Dyspnea, yes.
Hypoxia, tachycardia,
Hypotension,
Yes.
tensions,
Hypotension. Tachycardia will be there.
yes, ma'am.
Yes. Okay. So these are the causes.
Yes, ma'am.
Now let's talk about what this is all you have then understood that the pulmonary should be the nature. Okay. What are the causes? First cause I told you can be due to pneumonia. Yes.
Yes, ma'am.
Bacteria came.
Yes, ma'am.
There is a fighting in your alveoli
Yes.
and this is all happened. Okay. Pneumonia can be.
Bacteria, debris,
Sorry.
mucus, debris.
Debris. Yeah. Pneumonia.
Fluid,
Pneumonia is.
They are
Yeah,
also
sorry.
a kind of
Sepsis.
pneumonia.
Yes,
They are
sepsis can
also
be there.
type of pneumonia. No,
Yeah.
Causes of
sepsis will next step,
Abscess.
ma'am.
Yes.
When
Lung abscesses.
infection going to the blood, in that
Yes,
case, making a sepsis.
Yes, sepsis can be there. Abscesses, lung abscesses can be there. Cystic fibrosis can
growth.
cause.
Sharp,
Okay.
ma'am.
So these are the causes: pneumonia, sepsis, abscesses, lung abscesses, cystic fibrosis. So they can call.
Mucus, fluids, debris.
Yes. Okay. Next, let's understand what other more signs and symptoms. So there could be absent of lung sound also. Absent of lung sound can be there.
Minor cause crackles.
Sorry,
Crackles, ma'am.
crackles. Yes, crackles.
Sound.
Crackle sound. Yes. Okay. Can you tell me
Hemostasis
one?
in blood.
Sorry,
Hemostasis in blood. Clot.
hemostatis.
Hemostasis
Non-cough.
in blood.
Okay. MU, did
Cause
you? Yeah, I respect your thing. Did you
due
have you
to-
ever heard of virtual triangle?
Yes, ma'am.
sorry,
Did you ever heard of virtual triangle?
Yeah,
Yes,
we
ma'am.
did the
Short
group.
Yes, ma'am.
triangle.
What is this virtual triangle?
It is something
Statistics of blood
coagulatory.
flow.
In order to make clot, there should be three things. What
Yes,
is the
ma'am.
first
Yes,
thing?
ma'am.
Thrombus.
Hypoxia.
Statistic of
Hyper
Blood status.
coagulation.
Blood status. It means patient is in coma. Okay. Complete bed rest. Second thing can be endothelial damage due to your smoking. Smoking affect your endothelial damage. What is the third factor which involves the clotting of your blood?
Hypercoagulability of
Hypercoagulability.
Very good. Hypercoagulability. It means when a patient is taking tamoxifen. Did you heard about this drug tamoxifen? Estrogen, high dose of estrogen. So
Yes,
they
ma'am.
promote hypercoagulation. Okay. So you said Mule did what did you say just now?
Hemostasis.
But why there is hemostasis? Can you explain me how
Because,
why?
ma'am, when patient having a hypoxia, in that case, in the blood produce a hemostasis, and then they will cause by ischemic stroke or a MI when clot going to be brain. In that case, they causes a severe ischemia. Shortage of oxygen supply to the brain. If clot going to be hard, in that case they
I understand your point, but can you explain me how hypoxia is causing blood clot?
caused by, madam, we can say that
Found that out of TV.
due to respiratory failure, ma'am.
Yeah.
Hypoxia is the main cause of hemostasis, I think so. Maybe
you
you
have
know
to-
very well. I just say you
you have to explain with valid point. I will understand, but you have to explain me. If you're saying that hypoxia will lead to blood clot, give me a valid point.
Okay.
Because I think that these are the three factors which affect my blood clot. And
actually, ma'am, these signs are leading that furthermore diseases like ischemia or ischemia
yes,
and
hypoxia
CVA,
will lead to
hemorrhagic, and
ischemia.
MI.
I'm not denying the fact that hypoxia will lead to ischemia of your heart, and eventually you
Exact.
can get heart failure
I
or
mean
brain
that.
stroke.
Yes.
And
Yeah,
oxygen.
this you will have it. Hypoxia is leading cause of all this thing. This is you can have. But you're saying clot. Then I have to read about it more, then I can come and answer you. Okay?
Okay.
It's
Okay.
okay. So I'm saying that one thing is important. So in ARDS, okay, did you understood the definition of ARDS till now?
Yes,
Yeah,
ma'am.
acute respiratory distress syndrome.
Yes. And there has to be 4 criteria that I've already told you. Did you
Yes, ma'am.
understood the sign and symptoms?
Yes, ma'am.
Yes.
Did you understood the pathophysiology?
Yes, ma'am.
Did you understood the cause?
Yes, ma'am.
Yes, ma'am.
Next and very, very important thing comes the management. And management point, you all are going to tell me what is the management.
Prone position.
What
Protect
is
from infection.
no okay, whenever we talk about management, so management and prevention are 2 different things. So management in mean that already a patient has a disease and you need to counteract with the disease, and protection is when you don't want further deterioration of a condition. So you're talking about a
Prevention.
prevention point of view. I want asking management. If a patient with ARDS comes to you, how will you manage ARDS? What is the big thing involved in ARDS?
The fluids in the lungs.
Respiratory
ma'am.
failure.
This depletions in the
Respiratory
lungs.
failure. The main, yes, respiratory failure, and the main thing is the alveoli. There is a fluid fill, and then you cannot exchange gases because there is a fluid, and this tissue crosses across this membrane. So you cannot exchange gases, and the main function of the lung, which is exchange of gases, and this is being compromised. Okay, so this is the main problem. First thing
Yes,
you
ma'am.
can do is to position. Okay, whenever I think the first lecture I have told you
Yes,
that upright is the good position for respiratory.
Yes,
Everyone-
ma'am.
High
Flower
follower.
position.
This is what I
High
have taught you
follower
yesterday.
position.
Upright is
High
the
follow.
okay. High followers, upright position, high followers, anything which is a good position for your respiration. But when we are talking about upright and high followers are good position when we are talking about any kind of obstructive kind of respiratory problem. When a patient is having difficulty breathing, then you're going to give upright position. But over here, there's a main
Prone.
problem is fluid in the lungs. So the best position is given is prone position.
Prone position. Yes,
But question come, why
Prone
prone
position.
position?
to improve oxygenation.
This is not
To
a good one.
secrete the
There is
to
a
secrete.
much less chance for respiration. A patient in a prone position and oxygen will traveling clearly.
Okay. Just imagine this is a patient. Okay, this is the patient, and this was the trachea of the patient. So when you are placing a patient straight, there's a heart, okay, and there's a liver. So this liver is a big organ.
Yes.
Yes.
This
Yes,
heart is filled with fluid. Okay, there's a diaphragm. This is liver. This is diaphragm. This is heart. Okay, so whenever a patient is upright or the patient is lying flat, so they will put pressure on this organ. Okay, and already patient is supine, so everything is going like this. All the pressure is going downward. Yes or no?
Yes, ma'am.
Yes, ma'am.
If you're a bit aware of the anatomy of heart, the alveoli is present at the distal of the lungs. Yes or no? At the back of the lungs, most of the alveoli. So they are getting compressed because there's weight. If you're sleeping like this, so there is a weight you're putting on the back. Yes or no? You're putting weight
Yes,
on your
ma'am.
back.
Yes,
So the
yes, yes.
alveoli getting already they are compressed and you're making them more compressed. So in order to release pressure for some time, we keep the patient on prone position and just like sleeping like this. Okay, let me show you a graphical representation of it. So sorry. Okay. Understand one thing. क्या दिख रहा है clearly? नहीं दिख रहा ना?
दिख रहा है,
Hmm.
but words
Let me-
नहीं दिख रहे.
हाँ वर्ड्स नहीं दिखेंगे. आई नो. मैं थोड़ा कोशिश करती हूँ ना. अच्छा नहीं लग रहा है मुझे.
ARDS is a life-threatening condition. Na?
Because this is very acute. The sign and symptom worse within 1 week. Within 2 or 3, the patient, the PO2 is coming in 60. Okay, so that's why this is a very big problem. Now we got a good image. So do you also use what we say, that chat GPT?
Yes, ma'am.
Seriously, no, do not use. These tools are not good. I'm not saying just because
They have shortage of information, not
Yes.
like proper
not
information.
complete, you will not get a good knowledge about them. This is the problem. So that's why I'm asking you not to trust on them. Okay. I don't know why I cannot copy this thing. Okay, leave it. Can you just read the screen?
Yes, ma'am.
Yes, ma'am.
Okay. So listen one thing, when we are keeping a patient on supine position, okay, the patient is on their spine. Supine means on their spine. So what is happening? A gravitational pressure on the heart and mediastinum on the lungs. Okay, there is a gravitational pressure of the heart and mediastinum on the lungs. Okay. So there is a gravitational on the lungs. The heart is putting a gravitational force, simple, a force, gravitational force. There's everything on this planet is have gravitational force. You know, there is a G constant with force. Basic
Yes, ma'am.
basic physics I'm talking about. Okay. So lung is also compressing the heart in this position.
Yes.
Okay. So expansion of the chest wall and overall a less homogeneous chest wall compliance. So it means that the lungs is not becoming fully dilated when we are on supine position. That's why supine position makes it difficult to breathe. So once you will keep a patient on prone position, when we are on leaning forward on a prone position, then the heart is putting downward force. Yes or no? Okay.
Yes.
Yes, ma'am.
Decrease gravitational pressure of the heart. So there is a more recompliance of the heart, lungs. Okay. Second thing, decrease compression of effect of abdominal lungs on all lungs. Mean that decrease compressive effect of abdominal organ on the lungs. So abdominal organs are not putting force on the patient's lung in prone position. Third is more homogeneous chest wall compliance due to resistance of anterior chest wall movement. So there is a good chest movement. Understood?
Yes, ma'am.
Yes.
Yes, ma'am.
That's why we keep patient on
Prone
prone
position.
Prone
position. So
position.
that we can open the airways better because there's less pressure. Okay. Understood?
Yes.
Yes, ma'am.
Yes, ma'am.
Now, next question is, first management is going to be your
Position.
prone position.
Yes.
Second is your ventilator.
Yes.
I think most of the time we keep patient on ventilator. But wait, ventilator, PEEP. There should be a PEEP pressure. Okay, PEEP is not a mode of ventilation. PEEP is a setting in ventilation.
Yes.
PEEP is not a mode. PEEP is a setting. PEEP means
Positive and expiratory
very
pressure.
good. Positive and expiratory pressure.
Respiratory
It means
pressure.
that when we are expirating out, when we are expiration, there should be some kind of pressure present in your lungs that helps to prevent the collapse of your lungs. Okay, understood?
Yes,
Yes.
ma'am.
Yes, ma'am.
So you will, over here, you will set the pressure. So the maximum the patient is on pressure control ventilator. Pressure controlled ventilator. This is also a type of mode. So we keep a patient on pressure control, not volume control, on pressure control. Because if you increase or decrease the pressure, the alveoli can burst. Okay, understood?
Yes,
Yes,
ma'am.
yes, ma'am.
Okay. Third thing is your like one thing I'm talking. Okay, if it is due to pneumonia, you're going to get antibiotic. Okay, then you're going to give oxygen therapy to the patient according to the need. But one thing, when you will change the prone position, like we cannot keep a patient for longer duration in prone position because there's increased blood flow in the face and the patient can have a diaphoresis. Okay, there can be compression of vagus nerve. That's why we do not keep patient on more for a longer duration of on prone position. Okay, so what is the indication to change prone position? Indication to change prone position is your first is your
Facial flushing and trachycardia.
yes, very good, facial flushing, tachycardia, and facial edema. Facial flushing, tachycardia, and facial edema are the three reasons when you're going to change the position of a patient. Understood?
Yes, ma'am.
Yes.
There's a vagal stimulation. Okay, the vagal nerve get compressed. That's why tachycardia. I will tell you one very interesting thing in the last lecture. If you are promised not to leave the lecture, very interesting thing about vagus nerve I'm going to tell you today. Chalo,
Yes.
okay, did you understood about this thing? Okay, next let's talk about something about ventilators. So
Ma'am, can
yes,
you please repeat like other position for facial flushing, tachycardia?
I said when you're
Facial
keeping a
edema.
patient, yeah, facial edema, facial flushing, and tachycardia. So when you see these signs and symptoms in patient, you need to change the position back to the upright position. Okay. So did you remember in COVID-19, we kept patient on prone position? How much were there? How many
Yes.
of you were there during COVID-19? How much
Yes,
one?
ma'am.
How many of you were born when there was COVID?
Hi,
No,
ma'am.
I was not in this field when there was
So you were
COVID.
not in this.
We are also, ma'am, give
So you were not born.
intervention in a COVID-19.
No, I said I was not in this field.
You
I
were not
started
in the
after COVID.
field. Okay. I thought you were not born at that time when there was COVID. How long has been due to COVID? How years has been passed? How many years has been passed now?
It's been 5 years almost.
Are you sure it has been 5 years?
5
Yeah.
to 6 years.
No, 5 years. So it 5 years. Yeah. In March 26th was the day when we started pandemic. We considered as pandemic and there was
Yes,
Yes.
March, I
Yes,
think
ma'am, I
March
remember.
2022,
March.
22.
March 26th.
I did not give my
2020.
12th exams. Just cleared it.
Okay.
Maybe that time Farad in progressing their BSN.
Okay. So, MU, where were you at that time?
Yeah, we are also control isolations, COVID
Okay.
ICUs. Yeah.
So you have worked in ICUs.
Yeah,
We,
Okay.
I also, ma'am.
Who's this? Hamna, you
No.
have also worked in COVID ICU. Proud of you.
Bhavna.
Yes. I worked in Max Healthcare Shalimar Bagh in
That
COVID
time-
In
ICU.
Delhi.
ma'am, we done very critical and very panic duties in isolation and COVID.
So did you
ICUs.
remember
also,
we
ma'am.
kept patient on prone position?
Yeah,
Yes,
yeah,
Yes,
ma'am.
ma'am.
Yes.
Yes, ma'am.
For a few hour for 30 minute or a 20-minute
Yes.
patient going to be panic and they having
Yes.
a lot of sign and symptom, tachycardia, mental
Patient-
status change.
Yes.
So there is a
So not
very
long. You don't have to keep them in prone position for long duration. Okay, like
no,
maximum
ma'am,
30
for a
minutes to 1 hour.
few minutes.
Yes,
Ma'am.
30 to 1 hour, ma'am.
30 to 1 is the time when we are
Yes,
like
yeah.
maximum. But depending on the patient, we have to change the center. There's no
Yes.
set duration of time. Okay.
According to situation, ma'am,
Yeah.
we were handling.
According to the patient situation, depends upon various things. And but I told you the three things when you were seeing the patient, you need to change the position. Okay. Prone position, ARDS. Okay. Once then COVID-19. And third is atelectasis. So whenever you see these three things, you have to remember that you have to give patient on prone position. Other than all this thing, high follower and follower position is given. Upright position, high follower, follower position. Understood in respiration, three things is your exception. Other than this thing, you're going to keep patient on upright position. Understood about ARDS?
Yes,
Yes,
Yes.
ma'am.
Yes, ma'am.
Okay. So let's take break. Okay. And break will be of 5 minutes, not more than this. So you can just go understand about ARDS and then we will continue. Okay.
Okay, ma'am.
You're on mute, ma'am.
Sorry.
No. Now we are okay. We can hear you.
We all are?
We can hear you, ma'am.
can
Before
hear
you are on mute.
Okay, you all can hear me. It's good. Okay. So did you, any one of you studied how your hypoxia can cause clot? This was a question for your break. Break. What do you do in Shashikala in break? Shashikala, what do you do in break?
Ma'am, I just go through my notes, ma'am.
Acha.
Yes, ma'am.
Other than this, sleeping.
No, ma'am.
Leave it. I'm saying that you all should think about the topic which I discussed. Think means think on Google. Okay. Chalo, okay. So let's study more. Okay. Now, I think this will be your favorite topic, TB. What is TB?
Tuberculosis.
Yes, very
Ma'am,
good.
tuberculosis.
Okay. Tuberculosis. Okay. So this question goes to the Roslyn Sikandar. Tuberculosis is a
Yes, ma'am.
bacterial, fungal, or what is this?
Bacteria infection in lungs.
Bacterial infection.
Yes, it is bacterial. Okay.
Bacteria infection.
Yes, it is a bacteria.
It is a communicable disease.
Communicable. It is more than a communicable. What is this? It is a patient. We are going to keep, first of all, you need to understand one very clear thing. A patient with tuberculosis will be kept on airborne precautions.
Yes, ma'am. Airborne routes.
Okay. What is a causative agent for tuberculosis?
And myobacterium.
My tuberculosis.
Very good. Myobacterium tuberculi. Culi means more than, okay. 2, 3 things. 4th thing, very important. TB does not affect only your lungs. TB can affect your brain. TB can affect your spinal cord. TB can affect your bone. TB can affect your muscles. TB can affect anywhere in your body except your hair and nail. Okay. Okay. Can you tell me which vaccine in India which is given against TB? India and Pakistan.
I think in
Which-
Pakistan it is BCG, I think.
Yes. As well as India, we had. Do everyone have BCG vaccine when they were 0 year of age? Perhaps which year
Yes,
do you,
ma'am.
people get vaccinated in your country up for BCG?
Now I think here it is when the child get born.
When the child is born. Okay, when the child is
Yeah.
born, BCG vaccine. is given.
Infant.
Intradermal. Infant. Yes,
Yeah,
infant.
ma'am. It leaves the spot, for the
Yes,
whole life.
everyone have this spot.
I have it.
Yes.
Yeah,
You
I
also
have
have
ma'am.
it? Everyone have it?
Yes,
Rupa
ma'am.
missing? Missing? You're missing BCG.
Maybe they might give. I don't have the spot, ma'am.
You didn't receive BCG.
I got it, but I don't have the patch.
It means that you didn't get. Okay. How did you remember you get it?
always-
You were so
It
young at
always
that
leaves the
moment.
spot, man.
No, ma'am. My dad is a doctor, so he
Told
is
you.
very particular about those ECGs, all the vaccinations and all. Like even now, he'll tell me.
I think
Every
just
6
go and check
months,
your
go.
Nishan. I think it's in the right side, na? No, left.
Left
Left
side,
side.
ma'am.
Left, yeah.
Left side.
Okay. Okay. So one thing, this is what is Myobacterium tuberculosis. Okay. Your BCG vaccine prevent about your tuberculosis. One more disease your BCG vaccine protect you from. What is the another disease? Does
What is
anybody
that?
have heard of leprosy? Kushth
Yes.
rog.
Neuro.
Does anybody have heard about leprosy?
Yes,
Lepra,
ma'am.
leprosy. Which is the
Leprosy.
No,
bacteria
ma'am.
which causes lepra?
What is this?
You don't know about leprosy?
I'm hearing it. No, no, I'm
Mycobacteria.
hearing it for the first time.
You don't know the first name. Mycobacterium lepra.
Mycobacterium.
Mycobacterium lepra and Mycobacterium tuberculosis both belong to the same family, and your BCG also work against your leprosy. Leprosy is kush rog. So you don't know what leprosy is? You should know about leprosy.
Yes, ma'am. We know.
Infection.
It is an infection. Yes, it is an infection. This is bacterial infection. So
Yes.
this is leprosy. This is kush rog. Kori. Kush rog. People call it in India. So this is leprosy. Okay. They affect your bone. They affect your faces, your integumentary, Hansen disease, cutaneous root. Okay, so this is your until we have a leprosy day also celebrate. Okay, so this was more about just a brief about your tuberculosis. So what I said, the first thing, TB is tuberculosis. It is just spread by bacteria, which is known as Mycobacterium tuberculosis. We keep patient on airborne precaution, and over here India and Southeast Asia. So BCG is given. It is again given to protect you from Mycobacterium tuberculosis, and BCG also protects you from Mycobacterium lepro also. Understood till now? Okay.
Yes,
So
ma'am.
let's okay. This is a bacterial diseases. Yes or no? So
Yes, ma'am.
bacterial
Yes,
diseases,
ma'am.
you have to tell me the sign and symptoms.
Yes. Ma'am,
Low grade
fever, cough,
Yes.
Fever, green
chills,
sputum,
lethargy.
cough,
sweating, productive
productive
cough.
cough.
First sign and symptom that you all have to remember is your night sweat. What is this? This is your
hemoptysis,
Night sweat.
hemoptysis,
night sweat.
apnea,
Night
shortness of
sweat.
breath.
No. These are the common signs and symptoms which you're going to see everywhere. But when a patient complains with night sweat,
Yes, ma'am.
high chances the patient is having TB.
And chest tightness.
The chest tightness is seen. So you have to learn it from the most common to that disease to the general. So more specific to that disease to the more general. So this way you can remember the exact sign and symptom. Night sweat, fatigue, anorexia,
Lethargy.
Yes.
low grade
Ma'am,
fever, persistent
cough
low
like
grade
wind.
fever. Persistent low grade fever. Okay. Next, the patient is having
and
cough.
bleeding cough,
Yes,
No,
cough,
blood
And
cough
weight
is
loss.
late stage.
unexpected
loss.
weight loss. Unexpected weight loss. Yes, hemopatitis.
hemoptysis.
Next, productive cough.
Productive cough,
Very good, productive cough. Apart from productive cough more than 3 weeks. Okay,
3 weeks.
persistent cough more than 3 weeks. Lethargy. Okay, fever, low grade fever, night sweat, chill, fatigue, anorexia, cough with sputum, hemopatitis, blood tinged sputum, blood tinged sputum.
Blood things.
So blood tinged sputum you can see in a patient. Okay, apart from this thing, what is a okay? So what is the risk factor? Because you're going to get most of the question asking about risk factors. What is the risk factor?
Yes, ma'am. People living in the crowded spaces.
Very good. Overpopulation. Overpopulation. Beijing, Delhi, Mumbai. So any place of your Pakistan is more overcrowded?
Yes,
Islamabad.
ma'am. Islamabad is not, ma'am. It is public
Shower.
figure.
It's not
Shower.
Like Karachi,
Karachi.
Karachi or Shower, you can
Karachi is
say.
there.
Lahore, Lahore,
Lahore. Yeah,
Lahore.
Lahore is there. Yes. People who are more prone, who have HIV or your
Old,
STDs.
older patient, older clients.
Yes. Older people. Yes. AIDS, HIV, organ transplants, organ
Low
transplant because they are
immunity,
taking immunosuppressant. Or the patient who are taking immunosuppressant. Immunosuppressant. Okay. Next, children. Low in immunity, less than 5 years old. Patient who are alcoholic. Or patient who are taking IV drugs. Okay. So these are the people who are more prone for these diseases. Understood?
And then those who are living in crowded areas.
Overpopulation, crowded people, crowded slum. So TB is not a disease of rich people. But Amitabh Bachchan, Farhad, do you know who is Amitabh Bachchan?
Obviously, I watched just too many movies.
He's an actor, no? So he also got TB. So nowadays he's doing ads on TB.
Yes, ma'am.
Okay.
करोड़
Ma'am,
बने कौन बनेगा
malnourished
करोड़पति?
हाँ, कौन बनेगा करोड़पति ये? Yes, Bhavna?
malnourished patient.
Yes, very malnourished, like very malnourished. They're more prone for infection. Yes, you can say this one. Okay, understood?
Yes, ma'am.
Yes,
Okay,
ma'am.
very good. So let's talk about diagnosis. Everybody has to tell me what is diagnosis.
Sputum culture.
Sputum culture.
The basic.
PPD, ma'am.
Go to basic.
PPD, the Montex test.
Very good. PPD. PPD.
Yes, ma'am.
Montex
Montex
test.
test.
Montex test. Okay. Skin test.
Tuberculin skin test.
Yes. Tubercular.
Sputum test. Ma'am.
Sputum test. No, what is the other
Sputum
name?
test.
If PPD, Montex, TB skin test. So these are the three named to one diagnosis only. What is PPD?
Sorry, ma'am.
What is PPD? What is the full form of PPD?
Positive protein.
First protein, no. PPD. Roshan. What is the full form of PPD?
Ma'am, protein derivative.
Purified protein derivative. Purified protein.
protein derivative.
Very good. Purified protein derivative. So basically what happens when you take the bacteria, we remove their protein and we inject our body. So for example, okay, route is you're given through your ID, intradermal. So what happened over here? We use a flat surface. So I can use my anterior forearm, exterior, anterior forearm. Okay. So I can inject intradermally. Okay. Yes, intradermally. For example,
Intradermal injection.
just take this thing. Okay, just imagine this is the, so I have injected this, okay, in my skin, and I'm going to mark this with the pen.
Yes.
This is what we do.
Yes,
Yes,
ma'am.
ma'am.
So like for
Montex test,
example,
ma'am.
this,
Test.
okay, so injected.
Montex test.
So when I'm good, just imagine this is my hand does not look like this, okay? Just I'm making you for to understand. So this is what I have put in my skin, and I'm going to make a, so whenever I put this injection intradermal parallel to the skin, intradermal is injection, intradermal injection. You also call it as insulin syringe, okay?
Yes.
A very thin needle
Yes,
is
ma'am.
used. And then you are going to mark this
Mark
area. And then you're going to write the date, the time. Okay.
Time.
And you will ask the patient to do not rub this line. Do not erase this line. Okay. And after 72 hours, you're going to see the induration or the how much it has been spread. If it has been spread up to 5 mm, more than 5 mm or up to 5 mm, then if, okay, just imagine one thing, if a patient is immunocompromised, for example, a patient is with HIV, okay, and there is induration of more than 5 mm, that means the patient is positive.
Positive.
Okay, not means positive, it means that consider positive. Okay, we will not say the 100% surety, we will say, okay, we will consider it is positive. Okay, but in a patient who is non-com healthy individual like you and I, okay, HELTHY healthy individuals, then if it is more than 10 mm, okay, if it is bulge more than 10 mm, then mean we consider them positive. Okay, understood? Next, do not take or check the Montex test if a patient has received BCG vaccine in last 10 years, within 10 years. Like, okay, so a children 9 years of age, if you take their BCG, already they have a protein of BCG in their body. So what will happen? So your protein will get more infiltrated. So you're now going to do your BCG. Okay, let me show you a more dramatical BCG. Okay. If it is more than 5 mm, if the patient HIV or recent contact with active PV patient, nodular fibrotic change in chest X-ray, organ transplant, mean the patient is immunocompromised. If there is equal to or more than 5 mm, it means that a patient is considered positive. If it is more than in a patient who is less than 5 years old or high prevalence country, IV drug user, resistant to the comorbidity condition, children, infant. So if it is more than 10 mm, we consider
10 mm.
positive. More than patient with no his normal people, never had TB in their life. Okay, the people who are live in Canada, US, because TB is a very like European people. So there's no prevalence of TB. Write it down. It is very important. Just write it down. Note this thing.
If this disease is not common in USA, so will they ask about this in NCLEX or no?
BCG vaccine does not, it is not common. BCG is not a routine vaccine of those country. In NCLEX, we do not study about BCG. We have a different guideline for BCG. They don't have this disease because this is very, first of all, this is bacterial, okay? And this is not prevalence in their country. It's like it's spread from 1% to 1%, 1% of people. So they haven't had, but they might have, some people might have. Okay, Junaid, Farhad. 50 years from now, 50 years from now, earlier, we did not had obesity in our country, or asthma, or what we say, more of a
Diabetes.
cardiac problem or diabetes. Very rare people have it. Like,
Hypertension.
genuinely very rare people have it. But
Hypertension.
nowadays,
Especially cancer.
Yeah.
cancer. But now we are having it more. Earlier they had cancer. In our India, very few. When we were kids, we never have heard of cancer. Honestly
Yes.
speaking, I never heard about cancer, diabetes, something like this. Only infection, TB, I have heard of it. And you have also, in your country also. But nowadays, every second house is being, India is the capital of diabetes. So,
And
because
cancer.
there's so much of population.
Yes, ma'am. We are also not behind them.
Yes, we are also, this is happening. But that's why. This was not our disease, honestly speaking. It was forced into our country. We had a good lifestyle, according to the temperature, we were eating roti, sabji, dal, chawal, good food. We were having good life. But we are so much of brainwashed with pizza, burger. When I was kid, I was in 10th class, I had pizza for the first time. But nowadays,
Yes,
eating pizza is
very
so normal. And I remember pizza cost me 100 rupees, and that was a big thing. Like I asked, my pleaded in front of my parents, like 1 month continuous, let me eat pizza. Before that, I never had pizza. I'm not kidding. I'm not saying that like you feel it very abnormal, but okay, I'm just saying my your generation. You must have also heard it. But nowadays the fast food trend has been increasing so much that you know how kids are. They have been incorporated with phones so much that every I'm walking in the road, I'm seeing children, they have their own phones, they are scrolling reels, and parents are making them to scroll reels because they are disturbing them. If you're
Ma'am,
not giving
6
them
to
phone.
7 years of child said like my body aching, my legs are paining, my knees are paining.
Yes, and you won't believe I have seen a student of seventh class
Yes, ma'am.
killing parents for phone,
Yes, ma'am.
Yes,
Yes,
ma'am.
doing suicide, active on TikTok.
Seriously.
Yes, ma'am.
I honestly speaking, I'm not saying I'm not. We had also have so many. We had TV, we have Sonpuri, we have Hatin, we have Shakalaka Boom Boom, we have Shaktiman. We were
Yes.
also addicted. I'm not saying we were not addicted, but we have that tendency to wait. We had the tendency to wait for the next day. कि अच्छा क्या होगा?
Right. True, ma'am.
Yes, we had that guts to wait for the next movie. I don't know how much of you remember there is something called DD National. So half movie
Yes,
was
ma'am.
seen one day, the half movie was second
One
next day.
channel.
Okay,
Now
but
our
we are
kids,
going on a wrong hat.
now our 2 years babies also with phone only they are eating.
Yes, 2 years. What are you saying? 1 year child. They know better than us.
Yeah, simply they scroll the apps and find the YouTube and seeing the reels.
Yes, the most consumption of these social network is children nowadays, and people are targeting them. So we don't know, this is a very black market. Okay, leave it. Let's about tuberculosis. We went so far about it. Understood this thing?
Yes,
Yes,
ma'am.
ma'am.
Okay. Subain Khad, I think your country will be also having the same problem. Farhad?
Yes,
Perhaps?
ma'am, it is same. Yeah.
Same.
I said it's same, yes.
What can we do now? Okay. Next thing. So did you understood about your Montex text? Apart from Montex text, we have one thing which is known as sputum. Sputum culture is a gold standard. Sputum culture is a gold standard. Okay. Understood? Okay.
Yes, ma'am.
Next. Let's talk about some of the bacteria characteristics. You have to just know it. That's why I'm telling you. The bacteria are acid-fast bacilli. Acid-fast bacilli. Okay. Like they take stain. Okay. So you have to always take sputum. So how will you take sputum?
Early morning,
Morning
ma'am.
culture. Morning culture. Empty stomach. Fresh sputum.
These
Take three.
samples.
Okay. Take 3 sputum at alternative days. Okay. If all
Okay,
3 are
ma'am.
positive, if all 3 are positive, then we will consider the patient is positive. Then we will consider that patient is positive. Okay. You have to take 3 consecutive sample. And if all 3 samples come out to be positive, then only we are going to consider that the patient is positive. Understood? Okay.
Yes.
Next.
Yes, ma'am.
मैम just X-ray भी होंगे मैम
Sorry, Rosaline.
X-ray
Sorry.
just X-ray
Yes, I'm coming to the that topic only. So Okay, and to do the chest X-ray, so you can also go for chest X-ray, and you can see the lesions. Okay, opacity. So in the chest X-ray, listen, radiology is not a department. So no
Duration
patient.
क्या होता है? What is the time duration of this test to consider patient is positive?
So you're taking sputum when you see the patient comes to you with a complaint of chest pain, night sweat, anorexia. So you're going to take the sputum. So next day you will ask the patient to go for, you will do a Montex test. Okay. So
Yes.
Montex test can be positive, Montex test cannot be positive. So on the basis of Montex test, you cannot say that the patient is having the sputum test. Okay. The TB. Okay, if you're taking the Montex test and it come out to be positive, okay, just imagine it is in duration is like 12 mm. So what you will do? You will take the patient and
Positive
you
TB.
will do the chest X-ray. You're doing the chest X-ray, you can
Yes,
see the
ma'am.
lesion. But you will not dip because most of the time lesion to happen in your chest, it's going to take a lot of time. So you cannot say ki lesion is due to what or due to like it is due to the TB or not. So the sputum will be gold standard because the bacteria will get cultured because it is a bacterial infection. And then the next day, you're going to say the patient is having bacteria. You're taking the sample. One time it's positive. Cannot say just you might be some kind of infection or something. Second time positive, third time positive means a patient is positive. Okay. If 2 time positive, third time negative, then you will do a chest X-ray, get confirmed, right? Okay. Now, when you have considered my patient is positive, okay, there's no as a time duration, ki how much time, 2-3 days maximum, 1 day maximum, okay. You take the history. History is important. Have you ever been to a country? Travel history is important because we are giving exam of Canada, US, Australia. So over there, travel history is important because you have to ask that, have you ever moved to any South Asian country? Okay, or your Asian countries. Okay, leave it. Next, important point, a patient is no more contagious after taking TB drug sincerely for 1 month. इसका मतलब क्या हुआ? A patient is no more contagious if a patient is taking TB medication or religiously for a TB drug regime. It's a very long time. It might take to 6 months. It might take one year to get
Year.
healed from TB back. Okay, so it's a very long treatment. But we cannot keep every time the patient on isolation. Airborne precaution. Okay. So in this condition, if a patient is taking the TB medication for 2 to 3 weeks, okay, the patient cannot spread disease. So now the patient can go and do their work. Understood?
Yes, ma'am.
Rupa, Suben, Priya,
Yes, ma'am.
Rosaline.
Yes, ma'am.
Okay, so this is what I'm saying. I'm saying that patient is no more contagious after taking drug for 2 to 3 weeks. So patient can do their work. There's no problem. They can go for office. They can go for work. Next is, whatever happened in this universe, you are not going to miss the drug. Understood? Whatever happened in this universe, you're not going to miss the drug. Drug in India is given at community level, or ASHA worker go home and dispense medication. So over there, when you are discharged from the hospital, so you are under a community nurse. So community nurse will be kept in charge of your well-being. Okay. What are the drugs for TB?
Rifampicin.
Vancomycin, isomethicillin, pyramide.
What is the mnemonic?
cetrazole.
Ripe.
Bye.
R for
Rifampicin.
Vancomycin.
rifampin. I for
Ampicillin, isoniazid,
Isoniazid.
isoniazid, pyrazinamide. E for ethambutol. plus any antibiotic. In option, if you see antibiotic, broad spectrum antibiotic or aminoglycosides, these are also your TB drugs. But these are the core drug. Okay? Rifampicin, isoniazid, pyrazinamide, ethambutol. Rifampicin, isoniazid, pyrazinamide, ethambutol. Understood?
Yes, ma'am.
Yes,
Okay.
ma'am.
So let's do the next thing. You have to learn about all these things. So, but first of all, write one thing common about everything. First of all, never skip the drug. What I'm saying, never skip the drug. Understood?
Yes,
Second
ma'am.
thing
Yes,
is
ma'am.
avoid alcohol with these medication. All drugs are hepatotoxic and nephrotoxic. Avoid NSAIDs. NSAIDs are never given when there is some kind of GI problem, especially GI bleed, or when a patient is having any kind of nephrotic problem.
Yes, ma'am, because
Every
it can
time
cause
when-
ulcers.
Yes, it will cause insult because NSAIDs will block your COX, which is needed by your GI and your nephrons. Read more on this topic if you want to learn. Why? Avoid alcohol. Oh, I've already written. Avoid NSAIDs. Over-the-counter drug. Next. Before giving this drug, check for LFT and RFT. Renal function tests and your liver function test. Next, let's learn about your rifampicin. Rifampicin. Okay. Next, what is the most side effect associated with this drug?
Urine color will be dark.
Dark,
Orange.
red or orange. Okay.
Yeah.
Urine color may turn red or orange in any secretions. Okay.
Yes.
Secretions. So this is expected, normal. Do not worry. Okay, the patient is saying, I'm having orange color urine. Say it's okay. I know it. Okay.
Yeah.
No, you will never say this like this. You will say, don't worry. This is the never, don't worry. No. You will say, I understand your concern. The way you have to respond. If a patient says, oh my God, I'm having red color, a psychosocial question might come. Oh, I'm having orange color urine. I don't know, I'm panic. I'm in panic. So they say, I understand your concern. Don't worry. This is a expected side effect of this drug. Okay. This is how you're going to respond therapeutically. Avoid this, don't worry also. Just say, I understand your concern. This is the expected side effect of your drugs. I will increase your water intake with this drug. This is how you're going to respond therapeutically to the patient. And most questions come from these kind of topics. Okay. Next is your yellowing of the skin is not indicated. So if a patient is saying that, okay, I'm having a yellow color sclera, this is not expected. So
Yes.
yellow color is not expected because yellow color indicate
Jaundice.
very good. Yellow color indicate jaundice and which is not expected because it means that your hepatic is getting compromised. Next, do not your lenses whenever you are dealing with this patient. If they wear lenses, a lens will get stained and they will have problem. So do not wear lenses. Next, they deactivate contraceptives. So whenever a patient is taking contraceptive, like a female is taking any kind of oral contraceptive, so you will ask the patient to change the method of contraception because they deactivate the contraceptive. What are the contraceptive? Oral contraceptive? What is oral contraceptive?
Like here we have, ma'am, tablets that Yasmin. It's called Yasmin.
Yeah, Yasmin is
The
given.
name of that. Yeah. Then
Progesterone only pills are
yeah.
given.
Yes, ma'am.
Yes. Okay. Estradiol is given. Form of estrogen with the mix of progesterone is given. Then you
Yes, ma'am.
have Mala D, Mala N. So there are so
Yes.
many other pills available all over the world. Okay. So you will ask the patient to use other contraceptive, for example, barrier method of contraceptive. Understood?
Yes, ma'am.
Deactivate contraceptives. Okay. Next is your isoniazid. What next is isoniazid.
Sorry, ma'am.
Yes.
Like some patient they are keeping this implant on, so that will be okay.
Yeah, implants will be okay. Implants are very local. No, no, what
Yes,
else? Yes.
like implant and contraceptive implant on.
Mm,
Copper T.
copper T. Yes, copper T have a very different mechanism of action. So you can use copper T, no problem. Good. Copper T will not have any problem. If you're telling me about there are implant which is intradermally located and
Yes, ma'am.
yes. So let me, you can give that because every
Okay,
day
ma'am.
they release certain amount of drug in your body.
Yes,
So you can use that.
yes, ma'am.
Oral will have some problem because it will
Okay,
go
ma'am.
to your systemic circulation.
System.
That's why.
Yes, ma'am.
Yeah, systemic drugs
Okay.
will have problem. Local will not
Okay,
do
ma'am.
not have any problem. But I will read
Okay,
it more
thank you,
on this
ma'am.
and get it. Okay.
Thank you.
But copper T you can use it because it will have a different mechanism of action. Okay. Isoniazid, give empty stomach. Give empty stomach. Okay. Next thing is it decreases vitamin B6. Okay. What is vitamin B6? Pyroxidin. Okay. So patient can have pyridoxine deficiency. ISO say you can remember it by IQ. IQ is related to brain and brain have so many neurons. So this drug can cause peripheral neuritis. Peripheral neuritis. Inflammation of your peripheral nervous system. Remember one thing, I you can also mean remember it by mnemonic for IQ. IQ means brain and brain here neurons. So it can call neuritis.
Ma'am, your voice is
Ma'am, your
breaking.
voice
I can't hear
breaking.
you.
Yes.
Sorry. Class, can you see me?
We can see you, ma'am. We can hear
I
you.
don't know what happened in between.
Yes, ma'am.
Okay. So what I was saying about isoniazide. So iso means IQ. IQ means brain, and brain means neuron, and neuron means peripheral neuropathy. So the side effect is peripheral neuropathy. And why not this? As it decreases the vitamin B6, and vitamin B6 is very important to maintain your neurons. That's why you get peripheral neuropathy. And if a patient is having sign and symptom of memory loss or ataxia, numbness, slur speech, immediately report. If a patient is on isoniazide, write it down very, very clearly. If your patient is on isoniazide and a patient is showing you the sign and symptom of peripheral neuropathy, that is your ataxia, numbness, tingling sensation, slur speech, it means your neuron is getting deteriorated. And this is an emergency. You need to report to HCP. Okay.
Yes, ma'am.
Next is your isoniazide can affect your vision. Can affect your vision. Next, it deactivate your oral contraceptive. It deactivate your oral contraceptive. Understood?
Yes, ma'am.
Next, avoid tyramine-rich food.
Why tyramine rich food?
What is tyramine-rich food, Bhavna Mugdal? Bhavna? Don't know. Anyone? What is tyramine-rich food?
Chocolates, beer, any wine products, cheese products,
Right. Chocolate, old cheese, beer,
coffee,
pickle,
caffeine.
smoked paprika, cheese, any kind of fermented food. Pickled, your kimchi. You know what kimchi is? Yeah.
Yes, ma'am.
You know what kimchi is? Okay.
Korean,
Now it's your homework.
Korean
sorry.
special.
Yeah.
Korean special.
Yes. Okay. So write 20 to 30 tyramine rich
Tyramine.
food. Very, very important. Very important. Very important. Psychiatry, it's very important.
Yes, ma'am.
Understood?
Yes, ma'am.
Tyramine rich food. Okay. Next comes your pyrazinamide. 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 Okay. Does anybody know over here what is Gina?
Tina?
Gina, yes. Gina means, what do you mean by Gina? I think, Bhavna, you're from Delhi, right?
Delhi.
Yeah. So you must have heard about Gina. Gina pe chad ke leke aana.
Stairs.
Yeah, very good. Stairs. So Gina means stairs in some part of India. So Subail Khalid, are you in class? No, he's not in class. Farhad?
Ma'am. Yes, ma'am, I'm here.
Subail is your friend? Sanbel?
No, man, I don't know anyone in this class.
Okay. You need to tell them to be inactive in class. Okay. Okay, you are in
Mm.
class. So you can't speak. No, can't you participate because I want to ask something? Okay, you can answer me. Do you know in your country does Gina also mean stairs? Do you also use the same word? Farad?
सीढ़ियाँ बोलते होंगे मैं.
No, mom, we call it, yeah, the
When
word
it's
that
like
she
a
said, सीढ़ियाँ,
balcony.
stairs,
Stairs बोलते हो आप लोग?
yeah, सीढ़ियाँ.
So you call it
सीढ़ियाँ.
Yeah.
okay.
I have been never called Gina. Gina is like spending life here. Already nowadays.
But Bhavna, we know that Gina means CD. Okay, so
Yeah.
you will get difficulty in remembering this mnemonic. So pyrazinamide affect it increases your hyperuricemia. Acha, okay, it's okay. So, pyrazinamide affect your hyperuricemia. Hence, it will increase uric acid in your body. Hence, you will get a problem of gout. And whenever you climb up the stairs, you will get pain. So that's why I remember it through that Gina. Pyrazinamide means gout. So whenever a patient is taking pyrazinamide, it increase hyperuricemia level in your body. Hence, your uric acid increases. Hence, your gout will increase. Understood?
Yes, ma'am.
So what will you avoid? What you will ask the patient to avoid? You will ask the patient to avoid purine and pyrimidine. These are the basic amino acids. Purine and pyrimidine. You will ask the patient to avoid these kind of amino acids. Okay? And protein food also, like much in protein food also. Next, assess joint pain. When a patient is saying, okay, I'm having joint pain, joint stiffness, any problem related to joint, report. Because these purine or uric acid will accommodate in between your joints. Okay, they
Joints.
will inflame your joint and you will have pain doing like this. Okay, walking, writing. Anyone have problem while writing?
No, ma'am.
Anyone having problems in their finger while writing?
No, ma'am.
In their brain?
No, ma'am.
Thank you. Okay. So report. Okay. Next is your ethambutol. Next is your ethambutol.
Yeah.
Etham, so you can write is I. Ethambutol. So it can cause ocular defect. Okay. Photosensitivity. And yeah, photosensitive ocular defect. And so you will ask the patient to check their eyesight every 6 months. Okay. So these all about your RIPE. Close your notebooks. You don't have to remember it. Okay. Do not waste your time in a ratne wala thing or remembering thing. Remembering is the most easy thing to do. What is R?
Information.
Rifampicin.
What is R also means for red and orange color urine?
Yeah. Or any
Urine
Yes,
or
ma'am.
secretion?
any
Okay.
secretions.
So secretions. So whenever a patient is wearing contact lenses, their contact lens will get infected with red colors. So their eyes will become red. We don't want eyes to look. It will, the vision can form vision and it causes some problem in your eyes. So we'll ask the patient to remove contact lenses and wear specs. Okay.
Yes, ma'am.
Will it deactivate your
Avoid over.
contraceptive?
Yes.
Yes,
Yes,
ma'am.
ma'am.
Next. Yes, yellow color expected.
Yes, ma'am.
No, ma'am.
No, ma'am.
no,
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 it is
not
a sign of
No, yellow means
hepatotoxicity.
jaundice. And
Jaundice.
this is hepatotoxic, nephrotoxic.
Yes, ma'am. We can accept.
I mean,
Not
Cousin,
accepted.
no, not at all.
not
You are
expected.
killing your patient in front of your eye. Patient is saying, oh, look, my sclera is yellow, my buccal cavity is yellow, my face is turning yellow. You said, "Arey, leave it, don't worry, this is so normal." Will you do this thing, Kavaljit?
Ma'am.
No, ma'am.
Okay. Next thing. Will you take NSAIDs?
No.
No, ma'am.
No. Will
Avoid
you check
nothing.
LFT, RFT before the initiation of this drug?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Periodically also. Next, I for ISO. ISO means
Isoniazid.
Brain.
isoniazid.
IQ.
ISO means IQ. IQ means brain. Brain means
Peripheral
nephron.
neuropathy.
Neuron.
It can cause you
Nephron.
peripheral neuropathy.
Peripheral
Any sign
neuropathy.
related to ataxia, numbness,
Numbness.
tingling.
Numbness, tingling.
It has to be reported very fast. Go and report. Understood? ISO,
ma'am.
this is. It can also cause deficiency of vitamin B6. Very
B6.
important for your brain. Are you
Pyridoxine.
taking your vitamin B6?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Do you know what B6 means?
Pyridoxine.
No. It means Read your book 6 times daily. Sushil. So this is vitamin B6. B6 means book 6 times daily.
Okay, ma'am.
Vitamin. Okay. Chalo, just kidding. This is not mean. It means paradoxal. Okay. Next, apart from this thing,
ये
then
तो
you
याद रहने वाला है मैम.
have... Just kidding. Okay, paradoxal. Okay. Will you eat tyramine-rich food?
No, ma'am.
No, ma'am.
If I
No,
ask
ma'am.
the patient is taking isoniazid and go and give this chocolate shake with kimchi sandwich to a patient.
No, no,
No,
Smoked chicken,
No.
no, ma'am.
chole
no,
bhature.
No.
no,
Bhature. Yeah.
because that is spicy.
Arre, bhature is fermented food.
Yes.
Fermented food avoid. Any food fermentation, you're not going to give. Yeah, very good. Okay. I don't know how much of you can relate. Bhavna, you can relate. The good chole bhature from Purani Delhi's.
Yes, ma'am. Very delicious.
Very delicious. Chalo, okay. Next. Next we have. Next, your homework is go and write 20 to 30 food item which tyramine is fooded. Okay.
Yeah.
Go
Yes,
and
ma'am.
write it down. Just write it down. Don't need to remember it. Just write it down. You will eventually relate this thing. Okay. Next, you have pyrazinamide. Hyperuricemia, gout, and
Yes.
urine acid in your body.
Yes, ma'am. And we have to
Joint
report
pain,
it
joint
as well.
pain.
Immediate report.
Report immediately.
Decrease tyramine food, decrease protein, lean food, lean fat, lean calorie you can give. Okay. Ethambutol, especially eye. I'm not
Eyes.
saying that other does not affect your eyes, but among them, if the question is which drug affect the eye most, ethambutol. Okay, other also affect your eyes, but ethambutol affect the most. Any kind of optic neuritis, any kind of ocular problem, report. Check eye vision every 6 months. Understood?
Yes, ma'am.
Yes,
Till
ma'am.
now, did you understood about all this thing?
Yes, ma'am.
Okay. Now, a good thing I really want to teach you, very, very interesting thing that you should know about lungs. Did you ever heard about vagus nerve?
Yes, ma'am.
Ma'am.
Are you all active? Because I'm going to give you one good power thing to just understand. So what happened? Your vagus nerve is a nerve which is originating basically from over here, and just vagus nerve is a very long nerve which is a part of sympathetic nervous system. It is a part of a sympathetic nervous system. You know what? Whenever we take breath, at that moment of time, it basically affect your vagal nerve, okay, and your it deactivate your vagal nerve, and whenever we are taking a breath, at that time there is slight increase in the heart rate because we are deactivating the vagal nerve at that time. Whenever we are exhaling out, we are triggering the vagus nerve, and acetylcholine is released in your heart muscle, and there is a decrease in the heart rate of time. So your breathing affect your heart, and your respiration affect your heart through vagus nerve also. So that's why when we do like heart rate increases. So whenever we are in very angry or we can't make decision, so whenever we are going to breathe out very smoothly, your vagal tone increases, thus your heart rate decreases, and your sympathetic nervous system will overcome your parasympathetic nervous system overcome your sympathetic nervous system. And that's why if you want to be calm in your life, okay, take deep breath. Scientific reason associated with this. Understood?
Yes, ma'am.
Yes, ma'am.
So this was the last of the class. I think you have learned about 2 topics. Go study these topics in depth, okay? All free. Everything is free nowadays. You don't have to go to big libraries and index. You just go type, read more on these topics, make your good notes, okay? Don't rely, because what the best that I do in 2 hours, okay? My notes, what I'm teaching you is the best, okay? Notes will be your accessory things, but what you will learn will be your priority. So I focus on making your own notes. Handwritten notes are the best written. Do not get copied. You want any kind of help, I will be available, but do not copy. Do discuss in the question group everywhere. Okay. So let's end the class. Have a good day. Kindly study, enjoy, remember everything in your brain. Okay. Take care. Okay.
Thank you, ma'am.
Thank you,
Thank
ma'am.
you, ma'am.
Good night,
Have-
ma'am.
Okay,
Thank you.
bye.